Hi, have you ever said to yourself, I'll just take this pill and that's all I need to lose weight. I don't need to do anything else. Well, I definitely have seen several clients who felt that same way. In fact, I remember having a conversation with somebody where I was talking to them about the benefits of lifestyle change and incorporating. And they were like, listen, doc, I just am here for a pill or I'm just here for a shot. And I was so shocked. I was like, wait a minute, but this is important. And so I realized that, in medicine, sometimes we just talk about this pill or this shot like it's just this magic bullet that's going to cause people to lose weight and they'll be fine afterward. But unfortunately, there is no magic bullet. And so today we're going to focus on how we can incorporate our healthy lifestyle while also taking obesity medication. Welcome to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Alicia Shelly, and I'm so glad to be able to kind of have this opportunity to talk to you about a topic that, I see a lot, or maybe not a lot, but I definitely see pretty frequently in my practice. And I want to make sure, do a PSA announcement that there's more to just taking medication, that you really do need a full, comprehensive lifestyle change. And so I don't know who's to blame, why people get this. I think in life, especially as Americans, we tend to think that there's a magic bullet or there's something that if I just do this one thing, I'll lose weight and then that's it. But what I find, regardless of what people do, is that even if they were to change their lifestyle or even if they were to get on a medication, if they don't do both, then what happens is that once they stop taking the medication or once they stop doing the lifestyle change, the weight comes back. So it's important that we have the lifestyle interventions as our foundation. So we're going to talk about why that's important and how we can combine the two today. Now, let's talk a little bit about what's the most common medications that we see. So the very popular medications that we see for weight loss is going to be your Wegovy and your Zepbound. Now, Wegovy, its generic is semaglutide, so you may have seen that as well. And Zepbound's generic name is tirzepatide. And so these two are FDA approved for weight loss. They're once weekly injections that help with curbing your appetite, reducing your caloric intake, and they have the highest weight loss average in comparison to all the medications on the market. So with Zepbound, they are losing approximately 20 to 26%, whereas with Wegovy, they lose between 15 and 20%, depending on which study you look at. Next, we have our pills. Phentermine has been out since the 1950s, and so it's a stimulant, so it gives you energy, but it also curbs your appetite as well. Because it's a stimulant, like coffee, it can give you the jitters or palpitations, so as far as those side effects. And it can definitely affect your blood pressure as well if your blood pressure is uncontrolled. So, and that's the most common one, the phentermine. The next pill is Ozempic, which is a combination of phentermine plus topiramate. And so that can help if you just take it once daily, especially if your insurance is not covering the injections, you can pay out of pocket for the phentermine or the Ozempic. And then the third one is Contrave. This is a medication that works at your appetite center that tells it that you feel full. You're not as hungry with that as well. But that one is a twice daily pill. You take 2 in the morning, 2 at night. And so these are our common medications that we see. But the one thing I want to point out, with all the different studies that showed that they did to prove that they lost weight, they combined it with lifestyle change. So in order to get for that Zepbound between 20 and 26% weight loss, it included a lifestyle change. It included reducing your portion controls, exercising more. So you just can't have one or the other. You really need to have both. And so the one thing I would say too, especially when I have patients that take the Wegovy or Zepbound, and that sometimes it does curb your appetite, or even with phentermine, it does curb your appetite and you're not as hungry. But you do need to make sure you're getting enough calories with these medications, because if you don't, your body will go into starvation mode and it will hold on to the weight instead of burn it. So it's important to make sure that you're getting healthy calories, eating healthier meals to kind of give you the nutrients that you need. I'm not sure how long ago now, but definitely in one of our previous episodes, we talked about how you can be living with obesity, but be malnourished because you're not getting enough nutrients and vitamins due to the fact that you're not hungry with these medications. So it's important that you're eating a balanced diet, that you are, making sure you're getting your calories and not just saying, oh, I'm not hungry, so I'm just not going to eat. And before you know it, you're only eating one meal a day because that's not healthy. And you have to think about it in the long run. You need the vitamins that food provides. So the other thing I would say as well is the importance of a balanced diet. So how do we integrate diet with these medications? Now, because these medications do curb your appetite, it's important to make sure you get your protein in. The last thing you want to do is to lose weight and then lose muscle on top of that, especially if you are over the age of 65, because you need muscle to help with strengthening your bones, also to help with, making you more stable. And so sometimes if you lose weight and you lose muscle, it can lead to more instability. It can lead to falls. If you're younger than 65, you can maybe have more flabbier skin. So it's important to make sure that you keep your protein and that you're toning. So it is important to have protein. Also, protein can cause you to feel less hungry. So that can also lead to a smaller portion control. But like I said, it's important to have a balance in your diet and to make sure you are getting your calories in. But let's say you're taking these medications and you're just not hungry. What do you do? Well, this is when you actually try incorporating more protein shakes. In fact, there is a protein shake called Protality. It's an orange bottle, and it's actually made for people taking a GLP-1 because it just has a lot of protein in it. So that may be something to consider on the days, because if you're not hungry and you eat, you feel more bloated, you're not going to want to eat. But at least you can take protein shakes, or you can make a smoothie with protein so that you're getting your calories in and having a balance and getting your protein most importantly. Now, let's talk about medications and physical activity. Why is that important? Well, the one thing I would say is that exercise helps with burning calories. And not only does it help with burning calories, it also helps with toning. So if you're doing strength training where you're toning your muscles, like I said just a few minutes ago, it can reduce the flab. But then also, too, you're maintaining your muscles as well. So you're not losing it as you lose weight. I remember I had one gentleman, I was working with him for over 2 years, and to lose weight, and he was just so adamant about not exercising while losing weight. He's like, I'm just going to wait. And then after he lost, almost 200 pounds, he was like, oh man, I'm so flabby. What am I going to do? I was like, well, would you consider exercising? Would you consider strength training and actually toning your muscles? And he started doing that. He had less flab. Also, he's like, oh, you can't get him to stop exercising at this point. But it made a difference, the exercise. The other thing I would say is that regardless of what you do, whether taking medications or just doing lifestyle interventions, you will hit a plateau. It's just one of those things that happen. And the reason being scientifically is that we all have a set point or a certain weight that our body wants to be. And when we lose weight, our body wants to get back to that set point or that weight that's not as healthy, but higher than where we are. And so the body will decrease your metabolism to slow it down. It will increase your hunger hormone, so you're more hungry, to kind of help you gain that weight back. But it can be very frustrating when you see yourself lose 1 pound, then gain a pound, and lose a pound, gain a pound, where you're just kind of fluctuating in that range. So sometimes in order to kind of break through that plateau, you really need to incorporate more physical activity. And the other thing I tell people is like, hey, try to change up the type of activity that you do is helpful in order to breaking that plateau. Because your body will, since you are exercising, your body will actually improve or increase the amount of calories that are needed to burn in order to do that activity. And so you burn more calories, which leads to more pounds lost. So it is important to kind of incorporate more exercise in addition to the medications that you use. And I will say this, because sometimes people aren't able to, I've had patients who aren't able to exercise. Either they are, having really bad knee pain or just don't have access. And I find that people that do exercise consistently tend to be ones who are more consistent with their weight loss than those who don't. No, like I said, sometimes you just can. It's just not you're just not able to, but you don't have to do all the walking or going to the gym. You can do exercises at home that are low impact, that kind of get you going, even if you don't have access to a gym or other modalities or being able to walk, in your neighborhood. So let's talk about the importance of having behavioral changes and psychological changes too when it comes to medication. Sometimes if you've been battling with your weight for a long period of time, it can be discouraging. I know, because I remember when I had gained 20 pounds, in 2019, I was devastated. I was like, I had done so well. And then I went through a stressful period. I wasn't in a great place. And when I looked up, I had gained 20 pounds. My clothes didn't fit. I was starting a new job. And I'm like, what are they going to think? But what I found is that I had to address my emotions. I had to address how I felt and realize. And at that point, I realized that this is a lifestyle change. You have to have balance. You have to have a way to reduce your stress. I have patients that tell me like life is just lifing. And sometimes it gets crazy, whether it's obligations at work, at home, with family. And sometimes you find that it's just not enough time for you. But you have to find time for you. You have to make those boundaries because guess what? Only you are going to be able to take care of you. If you can't take care of yourself because you're just so burnt out, how can you take care of others? How can you meet your obligations? So it's important to have time. So some things that I do that helps me to kind of keep my balance and boundaries, because some days I look up and I'm like, I am just too busy, is that I make sure that I, first of all, get a good night's rest. That is important. But then secondly, I carve out time for myself. I tell myself, hey, at 7 o'clock, you're going to stop working and you're going to go and do something that you enjoy. Or I have that time for myself to just recoup. I'm not a big journaler, I have to admit, but I definitely love to plan. So I'll sometimes will journal a little bit about my day while I'm planning the next day. And it helps me to kind of relax and kind of say, hey, everything's there. I don't need to worry. Just be able to relax. Also, I enjoy a good audible book. So I love when I'm driving, listening to Audible. That's like my time, especially if it's a really good page turner. I love it. I love it. So finding things that you enjoy is going to be important too. The other thing I do enjoy is being out in nature. So sometimes going for a walk, going for a run helps me to reduce my stress. So it's important that we find time, when we're taking medication to be able to reduce our stress, finding ways to manage our emotions because it all plays a role. When we are overly stressed, we secrete a hormone called cortisol. That hormone is so instrumental in fat deposits and gaining weight. So it's important that we find ways to battle that and improve that. The other thing I mentioned here is sleep. Sleep is so important when it comes to weight loss because when you're not getting enough rest, you're sometimes eating to help with staying awake, or you are, drinking caffeine, other things, liquid calories just to stay awake. So it's important to make sure that you get that 8 hours so that you feel refreshed, so you have more energy, so you can work out, and you're not just getting home and being like, oh, I'm so tired. Let me just sit down on this couch and not move. So it's important that we kind of get our sleep in as well. So in summary, a couple of things I just want to say that it is important to incorporate a lifestyle change, your lifestyle habits with the medications that you take. Do not think that if I just take this medication alone, that it is a magic bullet, that I don't have to do anything else. That is not the case. We always have to do something else. So it's important that you combine the lifestyle changes with the medications as well. And that can include keeping a balanced diet, making sure you have a consistent exercise program, making sure that you're getting enough rest, that you are reducing your stress. And then most importantly, I always like to add this in, make sure you have grace, because there will be times where things just don't go the way you want to, and we don't want to get you off track. I have one gentleman who was like, I'm on track for a few months, then I get off track, and then I just go in a spiral. And it's like, well, what's causing you to get off track? He's like, well, sometimes, I got obligations at work, this happens, that happens, and I just can't be able to, keep it straight, and I just get off track. And so sometimes what it seemed like to me is that he had this expectation that he had to do everything perfect. And when it didn't happen because he had to stay late one day, or he went to a birthday party and they had cake and he ate a piece of cake and he got off his diet, it was like he wasn't able to get back on. So it's important that you give yourself grace in those moments because nothing is perfect, right? We're all human. We are all flawed. But if we just stay consistent with things, stay consistent with our exercise, regardless of, if I missed it last week, hey, today is a new day. Let me go ahead and get back in the exercise. Or, hey, let me do 10 minutes of this exercise since that's all the time I have. So making sure that you have grace and that you don't beat yourself up during the times when it's just rough. It's just rough. Life is just life, and you got obligations. Your things aren't happening the way you want to, but that's okay. You could still stay on track. It may just not be as perfect as you want it. Well, I thank you all again for tuning in to the Back on Track Achieving Healthy Weight Loss podcast. I look forward to talking to you next week on our podcast. And if you have any comments, questions, or concerns, feel free to send me a message. We'll be happy to include your question in the next podcast. All right. Have a wonderful day, and we'll see you all next time. And don't forget to like, subscribe, and share. All right. Bye-bye.